mental health is very important. So that was good. You needed a you day.
Yeah. All right.
It's 11. Oh, well, it's on top of the hour, so I'll go ahead and admit everyone.
Okay. Hello, everyone.
Hello.
How's everybody doing?
Hello. Good.
Good deal. We are, hopefully we'll have a few more people join, but I guess just for the sake of time, we can go ahead and get started. So thank you again for joining today, taking time out of your busy schedules. I'll try not to do the full hour just because I know it's always nice to have a little bit of time back in your day. This is our second quarterly regional coalition lead call. I keep saying I need to come up with some creative name for these calls because it's a very, very wordy title for a meeting. So if anybody has any creative ideas, let me know. Again, a lot of you probably know who I am, but maybe if you that don't, Alana Jarman. I work at Mountain Pacific, and I have quite a few Mountain Pacific colleagues on the call. At the end, I will have them introduce themselves because I'm sure they will want to provide some updates around their work as well. But for the sake of coalitions, I want to hear from you guys. We can do Zoom roulette, or if anybody wants to just go first, I just want you to let me know what's your name, your organization, your coalition name and location, what your coalition is currently focused on right now in terms of your resources, and kind of if you have any sub-work groups or anything like that. And then if you have any showcase or any best practice that you want to share with the rest of us that might be useful. So I see one person typed into chat, Patty Stickney. So maybe Patty, you want to unmute yourself and you can just give us a little rundown of where you're from, what coalition you're part of.
I was trying to type all.
Oh, you still there? Was it me or her? I know my Zoom has been super goofy today, so.
I can't hear her, Alana, but this is
okay.
Crystal.
Okay.
Patty,
oh, good.
Are you
Go ahead.
there? Is that you, Patty?
Yes.
Okay. I was just kind of going to defend Patty really quick because we just rebooted our Rock Springs Coalition, and so she's really getting on the call to kind of see how this rolls, and we are having our steering committee this week, but as far as projects, we're just barely getting the team back together. So really, I'm welcoming Patty. I don't know how, do you want to introduce your role in the Sweetwater Hospital there?
Sure. I'm a patient financial navigator, so we deal with patients that need medications as well as insurance and try to best fit their needs. And I have to tell you, thanks for saving me.
You're welcome. I panicked when Alana called on you because I was like, well, we're just barely getting up and going. And so
well, thank you.
You're welcome.
Perfect. Well, thank you for joining, Patty. And we're looking forward to working with you in Rock Springs. So how about Deborah Stone Walls?
Hello, hi everyone. I'm Deborah Stonewalls from the Maui County Office on Aging, and I'm a part of the Maui Community Partners in Maui, Hawaii. We are currently focused on replacing our head hospital case manager, who has been actually leading our coalition for several years. We founded our coalition, gosh, I think in 2010. And then we did receive at that point, the Office on Aging was leading it. We did receive a CMS grant for care transitions. And as soon as that agreement ended, then Joanne Bates took over, but she recently retired and moved to Vegas. So we're really trying to find a replacement for her to lead the coalition. In the meantime, I will kind of step up and do that. And we've done really well reducing our readmission rates. I don't see Maggie or Mark on this call, but and I was frantically trying to look back through my emails, but I know that reduced our readmissions quite a bit. One thing about Maui is it's because we are an island, we're kind of forced to work together, and that works in our favor in a situation like this because we engage with each other, we run into each other, we have one Target, one Walmart, one Costco. Odds are you're going to see people you know. So it makes collaboration very easy for us. So that's kind of a cool thing about living here.
Oh, I bet. I think that's, similar for most of the coalition work. You tend to step forward because you are kind of recognized as a leader. So thank you very, very much for what you do, for sure. All right. How about Leslie Starling?
Hi, my name's Leslie Starling. I work at Kalispell Regional Healthcare. The name of the coalition is a mouthful, the Northwest Montana Care Transitions Coalition. It is located in Kalispell. We've chose to focus, take September, October, and November to focus on suicide awareness and mental health. We had a foundation that presented last month. This month, Caitlin is actually going to do some community resiliency training. And then it's always been a mystery to our group of what the mental health providers do and how they do in the emergency department. And so we're going to have someone, a mental health provider from Western Montana Mental Health, kind of just give us a presentation on what that assessment looks like, because sometimes it's kind of confusing to who they keep and who goes home, and you might not necessarily agree with it. I guess a recent showcase is that we recently formed a task force with the assistance of Mountain Pacific Quality Health, and we're just on that side group out of the coalition focusing on more standardized discharge processes from either a skilled stay to home or to just these transitions, or even from inpatient to the skilled nursing facility.
Great. Well, you guys are keeping very busy then, Leslie.
Always. I'm actually going to have to multitask during this call.
Well, you're not alone, I'm sure. I'm sure there's plenty others that are checking their emails and whatnot. So no worries.
Thank
We
you.
totally get that. Thank you, Leslie. And I see Aggie, you're on. I don't know if you wanna, unless you have somebody from Guam on with you, but I thought maybe you could speak up for.
Hi, good morning. Yeah, we weren't too sure if there was going to be a meeting. Gladys said she didn't see it on her calendar, but checked my email this morning. Yes, it's 7 a.m. or thereafter, shortly after. Our organization is called the Guam Diabetes Control Coalition, and we want to focus right now on the COVID and diabetes rates that are really high. Right now, our territorial epidemiologist went on radio last week and reported that half of our deaths, and it's up to 60 now for such a small island, our death rate is 29.1%. In Hawaii, I think it's 9.1. She's reported that 50% of those who have died from COVID had diabetes. And so our coalition really wants to address this. And with the social distancing, and we are on what we call Core 1, Condition of Readiness 1, where only essential businesses are open, and things are really more or less shut down. It's hard to have you know, conferences or educational sessions. So we decided we're just going to do some kind of message blitz on social media. And right now we have formed the message and we're just testing it out on some people with diabetes through the Guam Diabetes Coalition. And if they say it works, then we're just going to send that out. We got a local hospital, the local hospital, to consent to put their phone number there as a resource that they can call. And if they get overwhelmed, the coalition, we're just going to have to come up with something how we're going to, offer some kind of classes online of some sort. So we're just getting our feet wet. We just know we need to do something and to address this issue. So right now, that's what we're doing. And also we're helping the Guam Diabetes Association organize their first, every year they have a conference, and it's attended by, 500, 600 people, and it's usually at the hotel. But this year, we're not having it. We're having it virtually, and Mountain Pacific is helping our coalition organize that. Thank you very much. And we're so grateful for that, and that'll be next month. So hopefully, with the social media message that the coalition is trying to put out, and with a conference, a virtual conference, maybe we can help somewhat, but we don't know. We are just trying several things. It's all new to us. So that's all. Sorry, I said a mouthful here.
That's awesome, Iggy. I'm so glad to hear about the diabetes kind of virtual meeting that you guys are doing. That'll be great. And I think a lot of us can agree right now we're doing a whole lot of pivoting, and one day it's this way, the next day it's a totally different way. So that's kind of the beauty of hopefully of these coalition meetings too, is I think we can allow each other to share what we're doing. And I think maybe there can be a lot of good takeaways that we can maybe apply into our communities that would reduce some duplication of efforts and work smarter, not harder type thing. So great job. Amber Rogers, she's a Mountain Pacific employee, but she actually leads 2 coalitions in Montana. So maybe you want to speak up, Amber. Oh, maybe she stepped away for a minute.
Sorry, no, I had myself on mute. You'd think I would learn after all this time. Anyway, for the Missoula Coalition, we actually had a case presentation where there were 3 different cases where patients had overdosed in the ED. And then they were lost for follow-up post-discharge. They were all successfully discharged. And so we really started having a conversation about medication-assisted treatment induction in the ED, and then transition to a MAT waivered provider out in the community or internally, depending on resources. And so that little project has kind of taken on its own little legs, which is awesome. So that's Missoula. Let's see. Well, I won't get into that. And then for Helena, this upcoming meeting that we have is going to be focused on their community paramedicine program that they've started. So that is lessons that could be learned for other communities. Currently, it is basically funded by the hospital, but it is for all patients, even those that do not have primary care in the hospital-associated clinics. So super interesting.
Sounds like a very cool project. Awesome. And then Crystal, sorry, I have a little fly. So if you see me doing that, I'm not losing it. It's just a bug. Crystal, I know you are also a Mountain Pacific employee, but I know you also help with coalitions in Wyoming. So.
So just so you guys, I guess, but what I can report is that we are in the central location, so that's the Douglas area, Casper area, we have looked at the HCAP scores and looked at how the patient readiness for discharge is only 50%. And that's not only in our region, but it's also statewide and national. And so we are recruiting researchers from the University of Wyoming to kind of help us delve into this project and help us with the data and kind of do a root cause analysis, and including the patient. You know, we have left them out of the equation for a very long time. And so we're trying to get patient engagement involved. And so it's really in the infant stages of this approach right now, but I think it's going to be a really cool project, and I'm excited to see where it goes. And then kind of as I just informed the group, Rock Springs area is just forming, rebooting their coalition. They were, actually, I'm very envious of their community. They all seem to work very well together, and they're very close knit. And so again, we are having our steering committee meeting this week, and we're going to maybe talk about the CNO of the hospital there is graduating with her doctorate degree, and she's doing stuff about I don't know if you guys have heard about the re-engineered RED toolkit, but they are instituting or working at instituting that in their hospital. So we're looking at maybe possible ways to involve coalition and patients around that project as well.
Awesome. I have actually worked with the RED toolkit, and it's a very useful toolkit. So it's good to hear.
Yeah, so I'm excited to hear. When I was talking to her, she said, yes, I'm doing this as my graduate project. And I go, oh my gosh, the coalition will love to help you, and we're all over that project. So
yep.
I'm excited. I'm really excited to work with both of these coalitions, and I'm very lucky to have them.
Well, and we are lucky to have you too. You're a great colleague.
Thank you.
And how about Eileen Ford?
Hi, everyone. Yep, I'm Eileen Ford, and I'm also from Wyoming. Not an employee of Mountain Pacific, but working on a contract basis with coalitions in our state. I took over one existing coalition that was the Northeast Coalition. Like most coalitions, it started maybe 5-6 years ago with the goal of cutting down on hospital readmissions. And when I took over, it had been kind of dormant for about a year. And so we have just kind of restarted meeting on a monthly basis. In terms of projects, that's kind of been a challenge, it's been a challenge with our existing coalition, I think, just because so many people are so, just up to their eyeballs with this COVID curveball situation. And that's also been a challenge. So I'm also tasked with starting 2 new coalitions in the Western and Basin areas of the state of Wyoming. Been working at that for a few months now, just trying to find out who our stakeholders are in those areas and gauging interest and trying to get some people to the table. Once again, there's a lot, they have a lot of other things going on, and it's not getting better in the state of Wyoming in terms of what's happening with COVID. So kind of what we've been doing right now is just providing resources, keeping in contact, trying to continue to build that potential coalition participation list in those areas, inviting them to meetings of other existing coalitions in the state if the subject matter is applicable to them. We are also looking at ways of perhaps partnering with other projects that are going on, other contracts. We have been talking with the Wyoming Department of Health about possibly working on some of the chronic disease management. We already have some contracts in place through Mountain Pacific, And again, as Alana alluded to earlier, maybe there are some things that, some challenges or some projects that we can assist with instead of duplicating the wheel. And so we also met with the Quality State Research Network and are excited about some potential there. They are going to present to our coalition this month. So just really still trying for a couple of them to get some foundation in place, and for our Northeast Coalition to find something to kind of sink our teeth into and start working on. So just really privileged to work with this whole group of people and look forward to hearing what you're all doing as well. So thank you.
Thank you, Eileen. Yeah, I think there's been quite a few people that just kind of, a lot of coalitions that have just been idling a little bit and trying to figure out how to continue to meet and do their work virtually together as a coalition. So how about Mark or Maggie, do you guys want to talk a little bit about the other Hawaii coalitions?
I can just basically say outside of COVID, there's basically what everyone has been focused on is the COVID work, making sure that from the hospital to the post-acute setting, the care coordination and the information that is necessary for the transfer to occur is happening, and how the partners can help the other partners get through COVID. Or I don't even know, it's not going away, but we still have to figure how we can support each other. And that's been basically all of the coalition's big focus right now. So I don't know what else to add on that.
And from the standpoint of our territories, we're very fortunate that in American Samoa, they do not have the COVID infection yet. So we spent almost all of our time meeting with them to discuss how to be prepared, emergency planning, working with other partners within the hospital, vendors, and other issues that come up. Last meeting, we did an entire session on telehealth. We worked with the Pacific Basin Telehealth Group and Christina Higa out here and her team to try to set up some different options, from kiosks within the hospital itself to creating a mobile van or truck or some sort of bus that would allow them to bring their own hotspot out to some of the remote areas and the tribes that are there with devices and with people who could help them, staffed by a nurse, kind of take a look at what was going on and to make a decision about whether this was a good telehealth visit or not. And we just got an email from Region 9, Ashby Wolf, saying that Guam Memorial had reached out to them asking the same thing about telehealth. So I think we'll be working with Maggie, Aggie, and Linus a little bit on working with the Guam Diabetes Coalition and setting up some telehealth work again through the Pacific Basin Group.
Perfect. Thank you, Mark. And let's see, I have Mary, hopefully I'm going to say your name right, Schramke. If you're unable to.
I'm on mute. I got to learn how to, do these things. I'm working with Mark and Agnes and other people. I'm on the Big Island of Hawaii. And as you can see from the background picture, there's nobody on the beach. Because that's just kind of how we are. We're pretty closed down. And so I think for the most part, yeah, we're trying to focus on diabetes education, but I'm relatively new to the island, come from near San Francisco, California, so I'm not really very well networked, but trying to help any way I can, and actually scheduled to help Mountain Pacific with the AARP Hawaii discharge planning seminar in January. So the red toolkit is, anything I can learn from that and other things. And I know Agnes and others have done some great jobs with diabetes. And like Mark just described with the telehealth project, for remote access. So right now I'm just mostly here to support things because I don't really, am not that well networked, but here to learn and happy to help any way I can.
That's awesome. Thank you. And how about Debbie Butts? Might be able to unmute yourself. If you press *6, Debbie, if you're on only by phone, you can unmute yourself.
Okay. Oh, that's interesting. My other button didn't work. Sorry, guys. I'm learning something new every day. This is Debbie with Bozeman. We've had a little bit of progress. It's been a little slow start with COVID, but we've got a project with some diabetic education, working with diabetic educators at our that's Bozeman Hospital. Patient pamphlet that could be used with patients throughout the various disciplines. So patients are getting a consistent message from the individuals that they work with. At least we're going to attempt that, and that's getting near its final stages. Just redid our charter, and we're looking forward to the 4M's framework education that's going to be in October. Thinking that that might be a good framework to utilize in some of our projects here in the Bozeman area. So, Alana, you've worked with us a lot. Is there anything I forgot?
I don't think so, other than you are going to be talking at your next coalition meeting about your name change, that you're going to change it to Southwest Montana Healthcare Coalition, correct?
Correct, but it's long, so it's hard to say. I know, but yeah, Southwest Montana. We're really hoping to kind of support some of the area a little more and get increased involvement in the area, which might occur, and have our name better reflect the area that we provide.
Yep.
Services for. So.
Yep.
Yes.
And I'm so glad to hear a lot of you are really, it's kind of, it's, from here to here on what you're working on. Just going back to, I think I have a slide on that later on, but the data wish list that you guys completed back in June, that the majority of everybody was really did want to focus on diabetes. So I definitely want to echo all of the hard work that you guys are doing, that internally too, we're definitely trying to find tools and resources to help mitigate or improve diabetes referrals and just things like that. So who have I not called on yet? How about Kyla? Do you have anything for Alaska?
Yeah, so I'm helping to support the coalition work here in Alaska. I work for Mountain Pacific. None of the coalition leads were able to be here today, but I can just give a brief overview of what we've been working on. There's 2 chronic disease management statewide coalitions that we've been working with, one for diabetes and one for Take Heart. And those groups had a little bit of a dip in their activity when COVID first started, but they've really been kind of reinvigorated in the last couple months. There's several work groups that right now are primarily working on looking at how to kind of virtually promote the diabetes programs in the state, as well as some of the other things like the self-monitor blood pressure work. And we also have a really rock star opioid task force at the state level. They've kind of dissipated their activity a little bit, but there's a local group that I've been working with that is a great example of kind of how a small community can support, and they have continued through all of the COVID time, really moving forward with their coalition and supporting the behavioral health needs in their community. So they are awesome, and they will actually be presenting on our full coalition call, which I believe is next week.
No, October 27th.
Okay. Yeah, so I'll let Stephanie toot her own horn when she's able to present to you the work they're doing. So I think that's about it.
Awesome. Well, thank you everybody for sharing what you're doing, where you're from. We definitely want to continue to support you. So as a pulse check, I don't necessarily think we need to go into this too deep, but that, we are here to support you, whether it's tools, resources, helping with keeping minutes at your meetings, setting up meetings, tracking your coalition members, helping with recruitment and retention efforts for your coalition to help keep them going. I think that's probably one of the biggest challenges a lot of coalitions is from what I'm hearing, and Mark definitely chime in too, but I think COVID has really, it's done a few different things, I think, just as a side effect, whether it's just kind of you're just kind of over it, trying to meet, trying to address the priorities, the front burner things, the priorities within your organization versus being on the coalition. So I applaud all of you. Thank you so much for everything that you're doing for our communities. Mountain Pacific wants to continue to support the efforts, and as you can see from what we're all doing, the scope is pretty wide for what we can focus our work on. So metrics and data, we will get to that in a little bit. We do have a little bit of good news that we are finally getting some of our baseline data, which really makes a huge difference on how to focus our priorities and what we actually need to focus our priorities on. And then, of course, those participation documents, the coalition participation agreement, or if you have a charter that your coalition is wanting to use, these are just things that we need to have in place for Mountain Pacific so we can share that with CMS. If any of you need assistance on updating or creating a charter too, that's something we're happy to help with. So at this point, for a pulse check, does anybody have any comments or questions?
There are some town halls that AARP is going to be doing, and we have formed a regional AARP team. So that is kind of rolling along, and in January, Mary, who's on this call, and Maggie, who's on this call, will be taking a look at discharge planning from both the person and the more clinical perspective. And so that's a nice sort of partner that we've added to our team out here in Hawaii, even though I know some of the other regional states, Alaska, Wyoming, and Montana have worked with them previously. So that was one of the things we wanted to announce. We'll have more information with that coming up.
Perfect. Thanks, Mark.
Speaking of that, Alana, I would like to add that out of our three of our Wyoming coalitions have added students to our coalitions. So that's been, we want to capitalize on their learning and their motivation. And so that's something that we're going to focus on as well.
That's awesome.
I think that's awesome, Crystal.
Yeah, that is great. This is Kyla. That's one of the things that we've talked about in our statewide, in the diabetes work group specifically, because some of the pharmacy students were going out and doing a lot of their experiential experiences at health fairs and some of the diabetes classes. And so just finding innovative ways for them to still get involved in a different environment that we're in now. So.
Perfect. Well, we wanted to provide some updates for you as coalition leads as well. I think since the last call, I don't know if, I guess, besides Kyla, I think you're the only one on from Alaska, so maybe most may not remember Preston, but Preston did leave us at Mountain Pacific, and we are in the process of gaining another employee up in Alaska to help with that. So we're excited for that. And then I think between Caitlin and Stevie, you guys can definitely talk a little bit about that COVID and chronic disease Learning and Action Network series.
Thank you, Alana. This is Stevie. I am Mountain Pacific staff located in Wyoming, but get to serve across the region. And we are continuing forward with our COVID and chronic disease webinar series. We're focusing on leaving in action for our next session, and we're talking about diabetes management in the time of COVID. So things that may have changed at your practice site, things that are the same, and different tips and tricks for managing those patients as we're working more virtually, and also trying to reduce the risk of our chronic disease patients contracting COVID. So anything you'd like to add there, Caitlin?
That was kind of the main stuff. Like she said, it's really focusing on empowering the patient as we talk through that. So like she said, those tips and tricks and what can we do throughout that. So that will kick off next week. If you haven't received the registration, I will be sure to drop it in the chat now so that you can register. It's a 4-part series, and definitely pass that on to your contacts. It looks like a lot of you are continuing to work on chronic disease. So this would be an awesome event to join. And then this will go on for the next couple months, and then we will have a little bit of a break during December, maybe some special sessions, and then we will be doing one on chronic kidney disease starting in January as well. So great opportunities to share best practices, learn from our peers, learn from patients. Really great, and plan for it to be very interactive. So definitely plan on attending those.
And then since you're on, Caitlin, do you want to talk about the Montana-Wyoming Chronic Disease Coalition?
Yeah, that's good. I actually was going to bring that up. So we are also looking at more of a regional chronic disease self-management learning and action network. So we are just in the infancy of building that on this multi-state level. And so I will have more to share on that during our 27th call, but right now we're actually looking for people to sit on the advisory board of that, so we can kind of help drive that. And we're definitely wanting representation, you know, from the different states and organizations. So for those of you that are interested, I will be sending out something where you can sign up to be part of that. And it'll roll out similar to this, where we do the group education, where we have that leading in action focus, patients involved, SMEs, all of that. So it's really going to be a great opportunity to kind of connect all of us throughout our different areas and really start moving that forward. Thanks, Alana.
Yeah, thank you. And does anybody from Mountain Pacific have any updates for nursing homes? Hi, Mary.
This is Mary. I can give a quick update. I was trying to get off mute.
Okay.
Am I off mute now?
Yep.
Okay, just checking. Quiet group. The nursing home work is really focused right now, of course, on supporting them through COVID-19. And we are working closely with the state epidemiology departments and the state survey agencies in all of our, across our region, to try to keep them as up to speed on all of the new changing rules and regulations and all of the items to keep people safe that need to be done. We are also advocating to start a new conversation with CMS about, you know, living with COVID and what that looks like in the nursing home setting, and how we can manage prevention of outbreaks and hopefully start to come out of the social isolation, because we recognize that that is going to start causing some probably bigger problems, maybe even than COVID-19 at some point. So we are starting that conversation and hopefully going to be advocating to safely open up nursing homes again. So thank you.
Thank you.
Mary Schramke also has dropped in the chat that she's on a national panel to improve flu immunization with CDC and American College of Physicians. They meet for the first time next week. So if anyone in this group could consider giving community needs to improve those rates, it would help her raise those relevant issues and solutions.
Hi, all. This is Mary. Thanks for that. I was thinking the reason why I brought it up was that I know that a lot of you are, helping out with COVID-19, and I think the reality is, that is going to commingle, so it's going to get mixed in with the flu. And if there's a way that we can, help support that, if there are some ideas of things that work or things that don't work. I know that a lot of you work with pharmacists and health, state health officials, but if there's, some specific community efforts that you think are useful, you can just, maybe reply to this meeting invite, or, maybe we can set something up. I can put my email in the chat box or whatever. But I mean, I don't want to bomb the meeting, but I just want to, I know you guys are experts, and I'd love your feedback if you have time. Thanks.
Well, for sure. It sounds like a perfect opportunity for us to help out. All right. What is new, what is old in terms of our task order work? Mary or anybody else, I guess. I don't think that there isn't really a huge change since our last call. But I might be forgetting something too. So Mary, if you have any updates, any changes in our actual CMS task order work?
Not since the last call.
Okay. Perfect. So how are you doing? Do you guys feel that you're having the right amount of support from us? If there's anything that we can help with your role as a coalition lead? And then also Teams and OneNote. So another option that Mountain Pacific can provide to you as coalition leads to give that extra little bit of technical support for tools and resources, so it's not so chaotic with emailing back and forth. If you want, we can set up a Teams file for your coalition, so you as a coalition lead would have access to it. And then at that point, then we can be putting in those resources, so it's more of a pull system. I don't know if most of you as coalition leads are familiar with the various Microsoft tools or not. But
Alana, Eileen might be able to speak to the ease of it and her experience. She has been, I think she was really the first one that we trialed it with.
Yeah, Eileen, if you have any.
Yeah, no, it is really user friendly. It is handy to have all of the documents stored to that location and accessible through that location. So we store our meeting minutes there. Any presentations that are done are kept there, are housed there, so that you can go back to those, utilize those for building on future on future programming or whatever we need to do. Yeah, it's just basically a couple of clicks and everything is stored there. When we have our Wyoming region coalition lead meetings, the minutes from those are stored there as well. So if something is created to help with coalitions for my particular coalitions, then they'll just notify me that there's something available to me there in Teams, and I can click on it and access it. And it's definitely easier than going back through emails and other notes and things to try to find something that I'm looking for, when I can just go to that one spot and there's a resources file and a meeting minutes and a file and etc. So yeah, it's really easy to use and worthwhile to have that.
Thank you. Yeah, I can also say that it's basically been the last probably 4 or 5 months that the internal team at Mountain Pacific have really been utilizing these tools, and it makes a world of difference when it comes to being able to share files and taking notes, and even when we're putting together presentations or discussing something, that we can have it pulled up right there and we're sharing it back and forth. So so of course, as indicated in this slide, operational updates at Mountain Pacific. Mary, did you want to speak to any of these updates?
Yes, I do. So the OneNote access and our expectations. So it's just a, you know, a tool that we want to put out there to make accessible to help you. So I think Alana covered that pretty well already. So reach out if you have any questions or need any more training or interested in that. Our website is going through a complete review, so it's not shut down or anything. It's still live and going. But a lot of the tools in this transition from our last scope of work to this one need some updating. And then we also want to put some more information on there about the coalitions and the important work that you all are doing. And so I just wanted to throw that out there to you for food for thought. We've talked to a handful of you already and gotten some great feedback on how we could put that information out there and have it be a little bit more visible, so that if someone is interested in a coalition, they have a place to go to find more information about what you're working on, what communities you're in, all of that kind of stuff. So we want to start working on putting something like that together, and we're definitely going to need your help in doing that. And of course, sharing only what you feel is appropriate for your coalitions. The other update is on our CMS baseline data. We are actually making some progress there, which I hate to say too loudly because I don't want to jinx it. It's been a different environment working with CMS on this data as it has been as opposed to in the past. They did change systems, and so that's been a very big change for our staff. So we are getting through that, and we should be on target for some baseline data mid to end November. So please watch for that. We do have a couple of things that there are 3 measures that we need to actually go out and get information on via a survey, and 2 of those measures are covered here, and we're going to need to be sending that out through the coalitions to the recruited providers and hospitals. And so Alana, if you want to just click on that, I'll give you a quick glimpse of what it looks like. We tried to make it as short as we possibly could, and we're trying to cover the 2 areas that we need to cover in one survey instead of asking multiple different surveys. So there is a part 1 that is about best practices, referring to the ABCS measures, which is aspirin, blood pressure control, cholesterol management, and smoking cessation. So that will be applicable to some of your providers. And then the second part is regarding opioids and opioid best practices in organizations. So hopefully it's not too long. If one area is not, it is logic-based, I guess, so that if one area is not applicable to those providers, they will not have to answer those questions. The survey should take about 10 minutes to complete. And then once we have that done, then that'll be part of our baseline information going forward that we can then aggregate and share in a de-identified format back to our coalitions. But it will drive the work around what kind of help is needed around those ABCS measures, as well as what kind of help and support and technical things and interventions that we can do with the coalitions around ABCS measures and opioids. Does anybody have any questions on that? We typically send it out. We can send it out by our standard list, but sometimes it is answered better coming from coalition leads. And so I don't know if you all have a feeling for that one way or the other. If you'd rather not be that person, or you'd rather this information come from you than us, that's fine too. Either way, there's no patient information shared. We should not need to get any kind of detailed agreement because it's all aggregate yes, no number type aggregate level data. So if you have any questions about that, we'll be sending that out this week. Any
I have a
preference
question,
on?
Mary, that's
Yep.
Eileen. So you
Mhm.
mentioned in terms of distribution that it needs to go to, it should be going to recruited members. There was that statement, but then also that it did not need, there didn't need to be any type of agreement in place with the people who received it because it's not patient data. So my question would be in terms of us distributing it, especially in situations where I have contact people, but not firm coalitions in two of these areas. Can that information go to these stakeholders, or does it need to be people in established coalitions that, that's essentially my question. How would we determine who, if we were distributing it, who we would send it to?
It would essentially need to go to those who have signed a participation agreement with us. But if you haven't yet started meeting with them, it could still go with them. They've signed the participation agreement. So it could still go to them. So that's my concern with, I'm not, I'm making an assumption that you all know who that is, but it might not, it might be a wrong assumption. So my other option is we can, and we've done this before with things that we send out by constant contact or something, like we send out the message and we also send it to you to encourage people to participate in a survey or in, giving us feedback or something as well. Because sometimes when it comes out mass email, people just kind of click and delete. So that's why every once in a while that other method is a little more effective. That's a great question though, Eileen. Did I answer it?
You did, yes, thank you.
Okay. I get to talking and sometimes I. So we'll be sending that out this week. Please let me know if you have any questions. The results of the survey will come back to us. So you won't, they won't, if there's any kind of question about who's going to see the results, the individual results, we will see the individual results. So, and then we de-identify them. We ask for contact information so that if there's any follow-up items that we need from the data or any questions we have about data they submitted, that we can follow up with them. So, all right. And then I think we just wanted to talk about upcoming events and activities and make sure that you were all aware of all the things that are happening. And if there are things that you are all doing that we need to be sharing, or things going on in your communities, that's another thing we want to get on our website a little more consistently, are the activities that you're all hosting and doing in your communities as well. So we'd like to help promote what's going on with you locally.
Yeah, we have quite a few different things coming up here. In fact, tomorrow is the first session of our data training series. And Sarah Leek and I, who Sarah's on the call too, I believe, I guess you are, Sarah, we'll be starting this. And so these are the dates. I think you guys can still see my screen. And to register to attend one or more of the webinars. And so once you do that, then you'll get an email informing you how to join those training series. They will be 30 minutes in length for the first couple. I think we have that set for the first 3 or 4. And then after that, one of our amazing analysts, Rhoda, she will be also putting some more pragmatic approaches with data for you to use within coalitions in your organization. So that's one of them. Also the MDS coding series, more for the nursing homes. So just on our website, you can go to this website and we will have these posted here. I'm putting it in the chat box here that you can click on to see what's coming up. Also the diabetes and COVID-19 series that Caitlin and Stevie were talking about. Also the nursing home TikTok series, trauma-informed care, specifically for nursing homes, but the information really is kind of generalized relating to trauma and resilience. So anybody is welcome to join those calls. And then of course on the 27th, we have our regional all-member quarterly call. So if you have not registered for that, or if you don't see that on your calendar, be sure to register for it. And then also your coalition members to join that. So those are some, just a little taste of what we have going on. Anybody else, Mountain Pacific, you want to speak up about any other events or educational activities? We have a few minutes left.
Alana, right before we hop off, I apologize, this is Stevie. I just wanted to let everybody know there's also a learning series coming out around opioid prescribing safety. And so keep an eye out for that in your constant contact from Mountain Pacific as well.
Great. All right. Well, any questions or comments? Anybody? Bueller? All right. Well,
Alana, where do we go to register for the 27th in case that they're not? How would they register for it?
they can go to this site here and just click on it and click here. I will also put this link. Hopefully my information doesn't show up. If it does, just delete it and put your own in. Click on that link and you'll be able to register for that regional community coalition quarterly call. So October 27th, and then the next one will be in January.
Cool.
And
Thank
like, yeah, you bet. And like Kyla was saying, one of her coalition members is going to be talking about the Alaska Opioid Task Force and the great work that they're doing. So we'll be showcasing a few people on that as well. All right. Well, I thank you everyone again for taking time out of your busy day. And again, if you have any questions, looking for some tools, resources, anything like that, please don't hesitate to reach out to your coalition contact or myself. And all right, thank you, you guys. Have a great rest of your day.
Thank you.
Thanks, everyone.
Thanks, everyone. Keep up the great work.